morning to everyone. Welcome to another exciting episode of Doctors on TV, the show where your health knowledge grows as fast as your curiosity. I'm your host, Dr. Baka. Mga kasambahay, we believe that learning is an adventure and the more you know, the more empowered you become. So, let's discover new ways to live better and healthier every Sunday together. Don't forget to hit that subscribe button so you won't miss health tips and knowledge we're bringing straight from medical experts to you. Moving forward, mga kasambahay, pag-uusapan po natin ang tungkol sa isang kondisyong maaaring hindi gaanong alam ng karamihan. Ito ay ang hemochromatosis. Isang kondisyon kung saan nag-aabsorb ang ating katawan ng too much iron at maaaring makaapekto sa ating mga internal organs. Para sa paunang detalye, alamin natin kung anong nationality ba ang may pinakamataas na posibilidad na maapektuhan ito. Bakit nga ba mas madalas itong makita sa kanila? Let's talk about it quick and get your every Sunday's dose of information.
Ang hemochromatosis ay karaniwan sa mga taga-Northern Europe, isang sakit na namamana kung saan ang sobrang iron ay naiipon sa katawan ng isang tao. Kadalasang hindi agad napapansin ang sakit na ito dahil hindi naman nakikitaan ng malalang sintomas. Kapansin-pansin na madalas itong natutuklasan sa mga nasa middle age o mas nakatatanda pa, at para sa mga kababaihan, kadalasan ay mas nahuhuli ang kanilang diagnosis. Paliwanag ng mga eksperto, nakakatulong kasi ang buwan ng menstruation ng kababaihan para maalis ang sobrang iron sa katawan.
At para bigyang linaw ang misteryosong kondisyon na ito, kung saan tila nagiging iron magnet ang katawan, meron tayong espesyal na panauhin ngayong araw. Mula sa Makati Medical Center, kasama natin ang isang eksperto para talakayin ano nga ba ang nangyayari kapag sobra-sobra ang iron sa katawan. Let us welcome Dr. Carlo Cornejo, a gastroenterologist from Makati Medical Center. Good morning, Doc Carlo, and welcome back to Doctors on TV.
Yes, good morning, Dr. Sarah. Yeah, it's nice to be back here.
Yeah, and it's joyous having you back. And ito may bago na naman tayong pag-uusapan. And ito na para maibahagi po natin ng maayos sa ating mga kasambahay. Doc, bigyan nyo naman kami ng mabilis na overview. Ano nga ba talaga ang hemochromatosis?
So, ang hemochromatosis, you get it from the name itself. Hemo is blood. Okay, chroma is color of blood. Osis kasi ibig sabihin may sakit. Okay? And nagsimula ito because they noticed that yung mga pasyente na may hemochromatosis, iba ang kulay. Okay? Kulay dugo ang kanilang skin. So that's where it's from. And what happens is that yung katawan mo, it gets too much iron. It's either because may problema sa genes or exogenous. Ibig sabihin, you're taking something that's giving you a lot of iron.
Okay, so you mentioned about iron, no? So, siguro, Doc, ito, ano muna ba ang function ng iron? And usually, ano bang dapat typical dose na dapat, na maintain lang ng isang individual just so hindi natin ma-encounter itong problema ng overloading of iron?
Well, iron is important in your body because it's one of the nutrients that we receive from food. The need for iron, depende kasi kung bata or matanda, babae or lalaki, pregnant, breastfeeding. It's different eh. Like for a typical na Filipino male, adult, you need about 9 milligrams of iron per day. Pero dumodoble siya with females, adult females, mga 18 milligrams per day kasi they have your monthly cycles, diba? Where you lose blood and majority of your iron kasi is there. It goes up even higher if you're pregnant. About 27 milligrams is needed per day because there's another person inside you that also needs that iron.
Dependent kasi yung individual. Yeah.
Yes. So, yun yung mga requirements na daily requirements natin. It depends on how you're built.
I see. Okay. And kanina lang, para for the interest of our viewers, you mentioned na syempre, di ba, because mas mataas yung requirement ng females because of yung regular menstrual cycle. Nagpapantay ba ang requirement when nag-menopause ng isang babae with that of a male individual?
Yes, that's right. Because as you grow older, you lose your cycles. Diba? You lose the blood loss.
Yeah.
So your requirements go down to a typical adult male.
Yeah, and also, I've noticed sa mga pasyente, I do not know if you have observed that also, na among sa mga matatanda, sa mga, yung mga lolo-lola natin na mahal, parang, mas po sila, siguro, is it because of the dietary intake nila? That's why, parang kalimitan prone din silang magkaroon ng anemia, bumababas, particularly the iron deficiency anemia.
Yeah. Well, let's put it in perspective. Kasi some of the iron-rich foods, medyo mahirap siya nguyain. So sometimes that's why the elderly don't get enough iron.
Sa ngipin nila, kasi lalo kung meat yung source.
Yes. But then, pag merong iron deficiency ang isang elderly, that's already one of the warning signs that we watch out for. These patients need to be investigated for serious problems in their body.
I see, okay. The reason why I ask, kasi pwede rin ba na kaya nagkakaroon ng hemochromatosis is because dahil previously may history ng anemia, and then, di ba marami, lalo na ngayon marami mga preparations that you can just get online, di ba, Doc? And marami nagsi-self-medicate. So, nagtitake ng iba't ibang supplements. Can this be also one of the causes bakit pwede magkaroon ng hemochromatosis?
Yes. So, aside from the genetic sickness, genetic illness, too much of taking iron can cause a secondary hemochromatosis. That's what you call secondary hemochromatosis. These are our patients who, for one reason or another, nagsi-self-supplement sila ng iron because they think that it helps them. But too much of iron can also harm.
Yeah. And ito, bakit nga ba nagkakaroon ng iron overload dito, like in hemochromatosis?
So, if it's the genetic part, so may defects sa gene that metabolizes this iron, these patients are predisposed to accumulate iron. But on the other hand, those who have secondary hemochromatosis, they're the ones who take beyond what is the daily requirement. Yung pinag-usapan ko kanina about 9 milligrams, 18, 27 milligrams. A typical iron tablet kasi would contain about 500 milligrams of iron, of which 20% is elemental and about 10% is absorbed by your body. Okay, that should be enough. But if you're taking multiples of that, that's too much.
Okay, so hindi kaya i-take ng katawan mo yan in excess of
No.
that. Yeah. Okay, and dito ba usually meron pong may age predisposition? How about the gender also? And baka may particular race po ba who are predisposed to this condition, which is hemochromatosis?
Kasi ang mga iron-rich foods natin are shellfish, red meat, nuts, and oatmeal, di ba? You think iron-rich ito. And it's mostly diet. It's mostly diet-related when you take in too much iron-rich foods. So you have to have a variety of diet kasi. Also, if you supplement with vitamin C.
Vitamin C, yeah.
Vitamin C kasi converts the iron into something that is more absorbed by your body. So automatically get the illness. Merong variability kasi yan eh. Some people have it and they only have minor symptoms. But some people would have the full-blown effect of the symptoms. So merong variability.
I see. So parang it can be mild in other cases, but it can be severe naman din.
Yes.
I see. And usually, the patients that you get to see with hemochromatosis, what would be the initial presentation of them upon you seeing them in the clinic?
Alright, so if you think about what happens with hemochromatosis, iron kasi deposits not just in your liver, deposits in all parts of your body, your heart, your pancreas, your skin, okay? So, anong manifestation? Not everyone will present the same. Some would be florid, sobrang sama, some would be mild lang.
I see. But is this a lifelong condition?
Yes, it is. Especially if it's genetic, it's going to be lifelong. But if it's something secondary,
Po na may hemochromatosis. Nako, marami pa tayong tatalakayin tungkol dito sa kondisyon na ito, mga kasambahay. Diyan lamang pa kayo at magbabalik ang Doctors on TV. Welcome back, mga kasambahay! Huwag bibitaw dahil mas pinalalim na talakayan ang hatid namin sa inyo ngayon. Kasama pa rin po natin si Dr. Carlo Cornejo, a gastroenterologist from Makati Medical Center para sagutin ang ilan sa mga pinakamahalagang tanong tungkol sa hemochromatosis. Eto, Doc, this time around, we'll be discussing naman yung mga diagnostic measures and yung management po ng mga kaso ng hemochromatosis. Okay, so ang tanong natin, usually ano po yung mga pinapa-request natin ng mga ancillary measures pagka nag-entertain tayo na ang pasyente na kung meron ba tong hemochromatosis?
You start with the complete blood count, CBC. Kasi doon mo makikita yung first hints na may hemochromatosis kasi malapot yung dugo nila. Okay? And then you can also proceed with doing an ultrasound and you look at the liver. Okay? You also look at the pancreas. Ito kasi yung mga organs that can be initially involved with patients with hemochromatosis. And of course, aside from yung mga tests na yun, you do your PE. Okay? Yung itsura pa lang kasi it gives you a clue na meron talagang iron overload yung mga
Yung sabi
patients
nyo nga kanina, yung dapat makikita mo sa balat na rosy ang
Yes.
ang balat ng mga pasyenteng may hemochrome. Hindi lang 'to yung basta yung mga rosy cheeks, 'di ba? Talagang generalized ang pagiging
Yes.
mapula ng balat.
Kung ang tawag nila, dusky ang color nila. Okay?
Dusky.
Dusky.
Oh, okay. And ito, Doc, no? So you mentioned kanina, apart from dun sa blood tests, you also request from some imaging studies. Usually, ano ba nakikita dito? Sa
Yes.
liver and sa pancreas?
So sa liver, if there's too much iron, di mas maputi siya than usual. Okay? And then you sort of get a hint na it needs to be investigated. And if you want to go further, after the ultrasound, you can do an MRI. MRI uses magnets, diba? And iron is magnetic.
Yeah.
Okay? So you can use an MRI to quantify the amount of iron in a particular organ.
So napansin natin medyo parang magastos bang
Yes.
magpa-check pagka may hemochromatosis?
Magastos siya, especially if you have to do the confirmatory test, the genetic testing.
Yeah.
Okay, and because you want to know the particular gene that is involved here.
But is it available here locally?
Yes, it is available here in our hospital.
Here at Makati Medical
Yes, it
Center.
is.
So you can have it checked. Okay. And so with regards to since may gene involvement, no, so it means na may possibility that any member of the family can also have it.
Yes, because hemochromatosis is really genetic. It runs in families.
So talagang it's advisable that if one gets diagnosed, maganda na buong pamilya para at least early on, medyo babantayan na, no?
Yes, that's right.
Yeah, okay. Kasi ito kung sakali bang ma-diagnose ng hemochromatosis ang isang tao, ano po yung pagdating naman sa management? Ano usually? Na-confirm na natin, this is really a case of hemochromatosis. What is your step 1 when it comes to management?
Management step 1, give blood.
Give blood.
Yes. Because when you take out blood from the body, that's already a load of
So
iron.
that's blood donation, by the way, that you
Yes.
meant. Okay.
There's a little issue there, okay? Because if you think about genetic hemochromatosis, that's safe for donation. Pero kasi sometimes yung blood bank ayaw nila tanggapin. Medyo mahirap. But yung mga secondary hemochromatosis, those caused by too much iron intake, that's not acceptable for blood for other
So,
people.
but if there's a controversy between, accepting yung donated blood by the hemochromatosis patient, I mean, it will
it's
still
not a
help.
controversy, but we would like people to know kasi that the blood of a patient with a genetic hemochromatosis is safe for use for other people.
Oh, okay. So you can attest to that.
Yes.
Okay. So it's 100% safe naman po pala.
Yes.
So walang dapat ikatakot yung mga blood recipients.
Yes.
So at the same time, so the benefits here are mutual. So basically from the hemochromatosis patient and of course, yung nangangailangan ng dugo. Lalo ngayon, di ba, ang dami talaga nangangailangan.
Daming nangangailangan.
Okay, so parehong natutulungan. Actually, kahit walang hemochromatosis, it's actually healthy. That's why we always promote, di ba? You donate blood when you can.
Yes.
Di ba? Yeah.
Agree.
Agree. Okay. So, ito naman, Doc. So ito yung tinatawag ba na therapeutic phlebotomy?
That's it.
I see. And since hemochromatosis is a lifelong condition, so it also means na regular po itong blood donation.
Yes, regular siya.
Oh.
Yeah. Because we can't get rid of the gene.
I see. Okay, and with regards to sa secondary hemochromatosis that you mentioned, na especially if it's secondary to too much intake of iron, usually na-identify din natin ito.
Yes, because the genetic testing would turn negative. So the treatment is you receive iron chelators. There are medicines like that na binabind yung iron to get it out
It's
of
like
your body.
chelation therapy. So,
Yes.
magbabind yung chelation kasi magbabind yung substance dito sa in this case, sa hemochromatosis sa iron. And then, if a flash out from the body.
That's right.
Okay, and usually, how long does it take before the patient, becomes clear of hemochromatosis?
Oh, these patients are monitored on a regular basis to reach a target kasi in the blood counts and it's different for each patient.
Saka hindi rin siya pwede, Doc, na one time na talaga, di ba?
Yeah, hindi siya one-time thing.
Yeah.
It's
series siya. O para hindi din overload for parang work overload for the kidneys,
Yes.
no? Okay, and how about lifestyle changes or dietary modifications?
So, I mentioned earlier na vitamin C.
Yeah.
Okay, it increases iron absorption. So we advise those with too much iron to not take vitamin C. Another is yung mga raw shellfish. You should not be eating raw shellfish because there's a bacteria called the Vibrio vulfinicus. Mahilig sa iron yan. So if you take it from shellfish and then nakita ng Vibrio na, oh, ang daming iron dito. So, florid ngayon yung sakit na yan.
Magmumultiply sila kasi parang conducive for their growth
Very
dahil napakaraming pagkain.
Yes.
I see. How do you call the bacterium?
Vibrio vulnificus.
Oh, okay. So talagang maano sila?
From
gusto nila
shellfish. Yeah.
Shellfish, so mga tulya, ganyan, like oysters.
Oysters.
Okay, and mussels or tahong. Ayan, so medyo bantay po tayo doon sa mga pasyenteng merong hemochromatosis. Okay. Pero ito, Doc, can we say na kapag po maagang naagapan ang hemochromatosis or early diagnosis, okay, and then can we say that the patient, can live naman normally?
Yes, they can live a normal life.
With special mga precautions lang doon sa mga
Yes.
na-mention nyo. Okay.
No, and there's one thing na trivia. Okay? Coffee kasi can limit iron absorption. So kung may problema ka sa iron overload, have coffee or tea.
Has it been proven, really? Talaga? O yan, ano daw po yan, take away. Don't forget that. Ang ganda yun, Doc, ha? Yun, so pag sobra. So meaning to say, doon sa mga anemic, especially iron deficiency anemia, i-avoid naman to, itong coffee tsaka tea.
Yes. And give them vitamin C, di ba?
Yeah.
To increase the absorption.
Galing, Doc, ang dami mong trivia, ha? Parang, yun. Okay, so mga kasambay, dami natin dagdag na kaalaman na nalalaman kay Doc Carlo. Okay? And ito, Doc, ito, I'm sure nasabi na natin kasi kaninto, how essential is it? I mean, gano yung farthest interval na dapat makikita nila yung katulad ni Doc Carlo, yung mga doctor nila sa hemochromatosis?
So, farthest, you do your annual medical examination. Okay? But preferably every 3 months, please see your doctor.
I see. And of course, syempre, lagi natin hinihikayat naman ng ating mga pasyente o mga kasangbahay. Nakita natin kung gaano pong kahalaga na lagi natin binibisita ang ating mga doktor. Mas maganda nga yung dinadalaw tayo, di ba, for wellness check-ups rather than yung may sakit kasi na binabantayan.
Yes. So remember, it's always easier to prevent an illness. We'd rather prevent illnesses than treat disease.
Yeah. We're very happy when we deal with healthy patients, actually.
Yes.
And with that, Doc, baka meron kayong ibang health advice that you can share sa ating mga viewers.
Alright, so even if hemochromatosis is rare, kasi nga mas common nga yung iron deficiency.
Yeah.
But if you have questions, our doctors are available to answer any concerns that you have. Please visit the clinic. Because prevention is better than treating illness.
Yeah, and cliche as it may sound, pero totoo po yun. Okay, and Doc, baka may gusto kang batiin?
Wala naman yung mga gastro
Friends.
friends, si Cheryl, you know who you are. And my four boys, hello.
Ayan. Hello sa inyo. And of course, you might want to invite our viewers to visit you here at Makati Medical Center.
Yes, so Makati Med is always open to any medical condition that you may encounter. So, like for gastro illnesses, we're here every day, 24/7. Visit us anytime.
Okay. So for more services, you may visit Makati Medical Center website at www.makatimed.net.ph, and you can also book an appointment using their website, or you can reach them 24/7 by calling their hotline at 02-8888-8999. 58 po yan at 39. Okay, and thank you once again, Dr. Carlo Cornejo, a gastroenterologist from Makati Medical Center. Ayan, and mga kasambahay, naku, sana ay marami po kayong napulot na health tips at kaalaman mula kay Doc Carlo. Tandaan po natin, think of this as your roadmap to a healthier, happier you. Pero hindi pa po dito nagtatapos ang usapan natin, kaya huwag pong bibitaw dahil marami pa tayong pag-uusapan sa pagbabalik po ng Doctors on TV. Ibabalik ang Doctors on TV. Mga kasambahay, may alam ba kayong mga natural na paraan upang matulungan ang ating katawan na balansehin ang iron levels? Lalo na para sa mga may hemochromatosis. Ngayong araw, pag-uusapan natin kung paano makakatulong ang tamang diet, lifestyle at mga herbal remedies para mapanatili ang healthy iron balance nang walang kemikal. Alamin natin kung paano pwedeng gawing kaalyado ang kalikasan sa pag-manage ng iron overload sa ating katawan. Exploring the wonders of nature, only here at Naturally Yours.
Magandang umaga mga kasambahay. Nako, kayo ba'y umiinom ng iron or supplement or sobra ba at iniisip ninyo na lagi kayo umiinom ng iron pero sulfate kasi kayo ay anemic or mababa ang dugo. Pero kahit kayo ay nag-i-intake, kumakain ng mga deep greens sa matataas sa iron, ay hindi pa rin tumataas o gumaganda ang iron level ng ating katawan. Nako, tingnan nyo na baka may problema kayo kasi ang iron po ay hindi standby alone na minerals kundi kailangan niya po ng ayuda. Yes, tama po kayo kasi ang isa pong iron ay kailangan number 1 ng vitamin C para po ma-absorb. Kaya kung kayo nagtitake ng mga iron or kayo kumakain ng matataas sa pagkain, gulay, prutas sa iron, kailangan po mataas din po yung vitamin C nyo bilang antioxidant na magdadala ng iron sa ating lining ng mga cells natin para mag-produce at mapakinabangan para yung factory ng ating dugo ay mag-produce ng tamang red blood cell, white blood cell, at even platelet counts. Ngayon, kung kayo naman po ay nagkakaedad na, kung kayo ay 50 pa above, at kung kayo po ay may mga problema sa mga plant-based source ng iron, at kung kayo na may animal-based, B-complex naman po ang kailangan nyo, especially the B12, lalo na po yung may mga issues ng pernicious anemia, na kailangan nakasabay or kasunod yung iniinom ng inyong iron. Marami po kayo makikita sources ng mga pagkain na mabataas sa B-complex, gaya po ng mga raw, na mga wheat, yung mga raw na grains, mga fibers, na pwede nyo pong isabay. Or kung hindi naman, kailangan nyo po mag-supplement kasabay ng iniinom nyong iron para hindi po masayang ang inyong supplementation ng iron. Isabay nyo po dyan yung pong magagandang herbal tea. Ito naman po ay makakatulong dahil relaxant, anti-inflammatory, yung pong chamomile, yung sage, at yung pong turmeric na makikita po natin available sa inyong mga garden or available sa paligid. Or meron naman pong mga prepared na natitimplahin nyo lang bilang tea everyday, ay magandang tulong para po yung ating iron, perosulfate, or kung ano pa man po iniinom natin na para sumigla ang ating dugo ay hindi masayang. Sana mga kasambahay, itong simple tips natin ay may natutunan kayo o may nakatulong sa inyo para po sa inyong problema sa anemia at yung pong umiinom ng mga supplement na iron. At para sa mga tips na magaganda, stay tuned dahil natural is beautiful only here at Naturally Yours.
Samantala, alam nyo ba na ang juvenile hemochromatosis ay isang kondisyon na maaaring magsimula sa murang edad? Tatalakayin natin kung paano makakatulong ang genetic testing at family screening upang maagapan ito bago pa magdulot ng malalaking komplikasyon sa mga bata. To know that and to keep your little ones healthy and happy, let's watch Baby Talk.
Magandang umaga mga kasangbahay. I'm Dr. Katrina Florcus Dacanay, your pediatrician for today. Anumang labis ay nakakasama, gaya na lamang sa kalusugan ng ating katawan. Ang ating katawan ay nangangailangan ng iron, ngunit ang labis ito ay pwedeng makasama. Ang labis na iron na naiipon sa ating katawan ay pwedeng humantong sa isang rare condition na ang tawag ay hemochromatosis. Kaya naman ating alamin ang kahalagahan ng genetic testing at family screening upang maagang madetect ang hemochromatosis sa bata. So let's start our discussion now. Ang iron ay isang uri ng mineral na nakukuha sa pagkain tulad ng meat, poultry, eggs, seafood at ilang gulay at prutas. Ang iron ay at masira ang mga ito. Ang hemochromatosis ay dulot ng problema sa genes na naipasa ng magulang sa kanilang anak. Ang gene na may problema ay ang HFE, ability ng katawan na i-absorb ang iron mula sa pagkain. Ang mga pasyente na may hemochromatosis ay hindi makontrol ang level ng iron sa kanilang katawan at ito ay naiipon sa mga organs tulad ng atay. Ilan sa mga symptoms ng hemochromatosis sa babies, changes sa skin color, pamamaga sa ilang bahagi ng katawan or edema, paglaki ng puso, symptoms ng heart failure at pwede ring magka-symptoms ng diabetes. Ilan sa mga test na ginagawa kung may suspetsya ng hemochromatosis ay ang blood test to check for liver function. Tinitingnan din sa dugo ang levels ng transferrin at serum ferritin. Kailangan din ma-check ang liver kaya pwedeng magpa-CT scan, MRI, liver biopsy or ultrasound. Ang doktor ang magsasabi kung ano ang mga best test na dapat gawin sa kaso ng pasyente. Walang gamot sa hemochromatosis ngunit may mga ginagawa upang ma-manage ito. Una ay ang pag-treat sa iron overload through phlebotomy. Nagbibigay din ng iron chelators kung labis na mataas ang iron sa katawan. Maaari ding magbigay ng hormone replacement therapy sa ilang mga cases. May mga binibigyan din ng gamot kung may joint pains, heart disease at heart failure. Ginagawa ang genetic testing sa mga pasyente na may symptoms at laboratory findings ng hemochromatosis. Ang genetic counseling ay importante dahil ang gene na ito ay maaaring mamana ng mga sumusunod na anak. And that's it mga
At yan po mga kasamba, our social media accounts. Please like and follow our Facebook page at www.facebook.com/DrZonTV and like and subscribe to our YouTube channel. Just type www.youtube.com/@UNTV News and Rescue. Maaari niyo pong balik-balikan mga kasambahay, lalo na po sa kalusugan, ay sana'y maghatid sa inyo ng kagalingan at gabay. Stay strong, stay healthy mga kasambahay. Always remember publiko. And syempre, BMPI's General Manager, Mr. J. Eusebio. May God always protect you both and grant you a healthy life. And syempre, binabati din natin si VP Nolly, VP Bong, VP Joseph, VP Jerry, VP Ruth, ang Dr. Zon TV production team, Public Service Department, at ang KDR Group of Companies. Hello also sa aking kambal, kay Iyo and kay Iya, kay EJ, kay Dr. Alamin, at sa mga pasyente po natin sa Baka Health and
272 Partner, ang DepEd Santa Rosa sa pakiki-272 Partner, ang DepEd Santa Rosa sa pakikiisa sa ating adhikain na maibahagi ang kaalamang pangkalusugan. Dr. Bahagi ang kaalamang pangkalusugan. Dr. Sara Barbacabudil would like to express her gratitude to Medical Depot Medical Depot, Healthy Nom Nom Food, Whirly Dough. Special thanks to Dr. Saturnino P. Javier, Medical Director, Interim Co-President and CEO of Makati Medical Center. Mr. Arnold C. Ocampo, Chief Finance Officer, Interim Co-President and CEO. Ms. Arlene L. Songco, Senior Vice President. Ms. Monica Reyes Dizon, Assistant Vice President. Dr. Ryan Raymond Y. Bautista, Head of Makati Med Wellness Center. Mr. Mark Funelas, Unit Head Manager, Communications and Special Projects.